Hi, I'm Dr. YVRao, plastic and cosmetic surgeon from Dr.YVRao Clinics, Hyderabad and Vizag. Today we'll be operating in a case of bilateral gynecomastia in a 23-year-old male patient. So I think gynecomastia, most of you may be knowing, it's a male boobs also called, and our development of a excessive breast tissue in males, starting from usually it occurs around puberty time, and the exact cause not known, but mostly due to the hormonal influences or variations, or even obesity also is one of the causes. Such sedentary habits, all these can lead to excessive breast tissue development in the starting from the puberty, and it never usually doesn't regress back. So when to operate such patients? Usually we wait till the age of 18 years, and then when we think that it is growing no more, or when it is not increasing anymore, then we try to operate depending on the wishes of the patient. And is it a must to operate? No, it's not a must to operate on any gynecomastia. But most of the patients do approaches for a simple one or two reasons. Mainly, when they go to swimming, when they remove their shirt or when they feel embarrassed, and also when they remove when they wear the t-shirts, the excessive breast tissue projects beyond the normal and looks awkward also. For these two reasons, the males approach for the surgery, that is gynecomastia surgery. And the answer is only one, surgery. There is no medical treatment for gynecomastia. And depending on the excessive development, it's divided into grade 1, grade 2, grade 3, which are of medical significance and not relevant to any but layman. So if it's whatever is, the answer is only one, surgery, which consists of removal of both the breast gland tissue as well as the fat, because normal breast contains everything together, connective tissue, breast tissue, everything, and fat also. So all the things we remove by a combination of liposuction and excision, we call it. So that's what we are going to do. And before that, we have to make that area bloodless. So what we do is we make a small neck, and this is the one cannula, about 3 mm cannula, which has multiple holes on this one, and this is the one which pumps it. Normal saline mixed with some amount of blood constricting agent, that blood vessel constricting agent called adrenaline, and some amount of anesthetic solution also, to keep the patient in a lighter plane by the general anesthesia. Of course, we are doing under general anesthesia, and if we can supplement it with the local anesthesia also, we can maintain the general anesthesia in a lighter plane, so that it reduces the complications also. So what I am trying to inject it, and I have injected almost completed on this side. So we have to wait for at least 10 to 15 minutes, and I'll repeat the same thing on the other side also. So now we'll be starting. I think I have injected on both the sides, waited for quite a few minutes, and then going to aspirate the tomato. So what the injection fluid is, for the sake of reducing the bleeding and also reducing the pain, but mostly for reducing the bleeding. It's called tumescent fluid, which we let it overinflate. That means some people give 1:1 ratio. If I want to suck approximately 500 ml, we'll try to give about 500 ml. But usually I prefer is 2:1, giving about 1 liter and then sucking about half liter. So that way we can get more, or rather say better aspiration with the less bleeding. So now we'll start. This is the cannula of 5 mm, which has a holes at the tip, and this is standard liposuction, we call it. Some people use the difference between conventional liposuction, ultrasonic, and other forms of laser types is only at the tip region, and the handle will be. So the handle will be totally different one. Whereas the suction part, everything, the tubings, everything is the same. And this handle has a mechanical vibration. It vibrates like this, which decreases the strain on the surgeon more. And the other one has an ultrasonic one, is produces a small ultrasonic waves from the tip of the neck. So what is supposed to do is, one is a better lysis of the fat cells, and some amount of supposed to be skin contraction also. but and the other one is a laser one. So the laser one, it emits the lasers from this tip region. So the two energy devices, for example, the lasers and the ultrasonic waves, and not the vibratory mode. The laser and ultrasonic one, what can produce? If inadvertently kept for even a few seconds beyond it, that means at a constant place, even for a few seconds more than normal, that is, even 2-3 seconds also, it can produce burns in this region. So that's why one has to be very careful with the energy devices like laser lipo and ultrasonics. And we have seen adequate or enough number of complications with this one, where we have to remove the excess skin and then remove and then put a piece of graft taken from the thigh and put it here, and which looks very awkward. That means if you come for a cosmetic reason and if I give a bad result like that, give you one patch of skin, you will be horrified with that result. So conventional doesn't produce, or rather we can say, least harmful of all the devices. So now we'll start to a small hole in the circumareolar this region. This is called the areola, this is the nipple, and this one. And at this junction, we make the skin about a 1-inch incision. But before that one, I make a small puncture like this, and then insert the cannula and try to hold the skin like this. And whereas some people hold the like this, it doesn't matter as long as we give the result. So first we have to concentrate in the zone of, that's where there is a maximum amount of breast window. Then peripherally, we call it fanning out. So that it doesn't produce a shouldering effect like this. It's smooth transition. Yeah, this is the wave part that comes out, which is a yellowish color mixed with some amount of the injected fluid. What we do is we remove the glands part of it, which is a little white. But in this patient, it's more of a fat than the glandular part. So you can see the glandular part, which is white in color, and the fatty tissue part of it, a little more. Fibro-fatty tissue part is a little more. Actual glandular part is less. So this is what we do, and then we camouflage and then nicely merge with the surroundings. There should not be any sudden dip from the surroundings when you do that or removal of the gland. So if you remove the gland only, or like a lump, if you remove, there will be sudden depression at the peripheries. That's called saucer deformity, which should be avoided at any cost. So that's where the plastic surgeon plays a significant role. As we know, a little of aesthetics part of it, we try to match with the rest of the surroundings. And if there are any bulges somewhere in by, they become prominent after the removal of the correction of the gynecomastia. That also we try to do it, so that the patient will be happy at the end of the surgery. In 2 layers, and afterwards the inside deeper layer will put, followed by skin separately. So deeper one is an absorbable stitch, and so otherwise if you don't close the inside one, what happens is the wound may gape. So good bite on the deeper tissues should be taken. We have to make sure that there is no bleeding, and then we close the wound. And put 2 drains temporarily. Maybe I'll remove it in about 48 hours. Some try to bring out this suture with a separate stab incision. That's good enough. But to avoid a scar, I have gone to the extreme edge of the incision. That is the cut that I made. So there will not be any extra scar. Because in medium to dark skin people, what happens is most of the times the scars heals very badly, and then pigmentation will be more, and it takes quite some time to improve, or sometimes it may not improve, and there may be permanent pigmented scars on their body, which are telltale signs of any surgery, or they have to cover it by saying the injury or so. So this is one non-absorbable suture. This is used for quilting. That means we are trying to obliterate the dead space between the skin and the underlying tissue so that the skin it is right at the place where it is sutured, and we remove in about 2 to 3 days time. So this is to take away the excess or redistribute the excess skin all over this region. Otherwise we have to remove a piece of tissue and then piece of skin, and then it leaves a very bigger scar. So I suture it to the underlying structures. So I know I have grasped the muscle, so I'm damn sure that. So just to prevent any scar on the skin, so I put a small bolster. There is a piece of gauze piece. So like this we put, this is called the quilting stitches. From liposuction, this is the amount of glandular and fibrofatty tissue that is removed on the left and right sides. So I have put quilting stitches all over the area that I operated, and that's it. And then because to redistribute the skin, so it gets stuck wherever it is, so that there will not be any excess skin or hanging of the skin or the loose skin because of the excess. Gynecomastia is almost grade 2 to grade 3. And when we remove the underlying tissues, the skin will be more. So we have just redraped the skin by these quilting stitches.